Hello everyone. So in this session I am going to discuss cell adaptations. It's a very important topic for university exam questions. So before coming on the topic, let me show you the important university exam questions which are coming from this topic. So you can see the long questions coming from this topic and the short questions coming from this topic. From the long question it may be asked that define cell adaptation and write all the 5 types along with their mechanism, examples, types, everything. And in short questions, you can get a short note on any one of them, any one of the 5 on them. Maybe on hypertrophy, hyperplasia, metaplasia, dysplasia, hyperplasia, anyone. And along with that, you can get to write the differences between any 2 of them. Just for example, you can get the question like differentiate hypertrophy and hyperplasia, differentiate atrophy, hypertrophy and hyperplasia, differentiate hypertrophy, hyperplasia and metaplasia, or between metaplasia and dysplasia. So you may get the differences, you may get the short note, or you may get the long note on all 5 of them. So you should be prepared for all, right, in this topic, right? So let me start. We know human body is made up of cells. Cell is the structural and functional unit of life. We know that. The complete body, the human body from head to toe, we all are made up of cells. Usually all the cells are in homeostasis. What do you mean by homeostasis? God has given a particular structure to all the cells to perform a particular function. For example, the cells of our salivary gland, they have a function of secretion. The cells of our intestine, they have a function of absorption. So whatever function assigned to that particular cell is having particular structure for that function, and they are performing their own function, that is known as homeostasis. But whenever, usually the cells are in homeostasis, but whenever any stress acts on the cell, now stress may be physiological or pathological, 3 things will happen one by one. Let me draw the 3 things for you. You can see this is a cell. Let me draw a cell for you. This is a cell. Now, as I have told you, whenever any stress acts on the cell, the stress may be physiological, may be pathological, the first thing happens is the adaptations. So, cell will try to do the adaptation to overcome the stress and to again achieve a new state of homeostasis, you can say. So, the first stage is adaptation, which is always reversible. Reversible means once you remove the stress, the cell will again undergo the normal structure and function. That is adaptation. Adaptations are of 5 types that I will discuss in this session. Number 1, if the stress continues. If it is continuous for a long time, the second thing happen is reversible cell injury. It is reversible cell injury. So cell will have certain injury again, but it is reversible. Once you remove the stress, again the cell will become normal after some time. It is reversible. But if the stress continues even for a longer time, the last thing which happen is irreversible cell injury. You know the other name of irreversible cell injury? Do you know the other name of irreversible cell injury is cell death? You know, cell death is nothing else but it is irreversible cell injury. As the name indicated, is death. It is irreversible. Once the cell is dead, you cannot make it alive again. So this one is irreversible. Even on removing the stress, you cannot make it alive again. It is of 2 types, apoptosis and necrosis. So here we have to discuss 3 topics one by one. So in this session, I am going to discuss adaptation. In the next session, I am going to discuss the reversible and then followed by irreversible cell injury. So these are the 3 things happen when any cell is undergoing under stress. So you can learn it with an example. Let me quote a beautiful example here to make you understand. How many hours you study in a day? Can you tell me the answer? How many hours routinely you study in a day? 4 hours, 5 hours, maybe 6 hours. Impressive. So that is your homeostasis. That is the homeostasis of your body that you are studying for 4, 5, 6 hours in a day. But what about the day before exam? One day before exam, how many hours you study? Yes, can you give me the answer? Some will say, ma'am, 10 hours, 11 hours, 12, 13, maybe 14, 15 hours. Good. So what you are doing, it is actually the adaptation. The exams are acting as a stress here and your body is adapting to overcome the stress and achieving a new state of homeostasis. So you are studying more hours, that is the adaptation. But what about once the exams are over? How many hours again you will study? Again you will be back to the normal, that is 4 to 6 hours. You cannot study continuously for 12 to 15 hours daily. During exams it's okay, but after exams again the body will go to the basal state, that is homeostasis. But what if the exam continues for a long time, maybe for 2 months, 3 months, 4 months. So continuously you are studying for 12 to 15 hours, so your body will have diseases. You will have sleep deprivation and certain diseases. That is reversible cell injury. But once the exam is over, again your body will regain to a normal state. But what if the exam continues forever? Can you imagine the situation? You always study for more than 15 hours. Is it possible? No, the cell will die, right? So you can learn it with this example. So these are the 3 things which will happen one by one if the cell is undergoing stress. The first thing is cell adaptation. The second thing is cell injury. First it is reversible cell injury followed by irreversible cell injury. Between reversible and irreversible cell injury there is a point of no return. The point of no return, what do you mean by that? After crossing this point, even if you remove the stress, the cell cannot go to the normal homeostasis stage again. Reversible cell injury are reversible. Once you remove the stress, it is reversible. But irreversible are never reversed, as the name indicate, even on removing the stress. This is known as point of no return. Now, so you got it. This is the overview. Right, in this. So can I say 3 things? One by one will happen. The first thing which will happen is cell adaptation. The second thing which will happen is reversible cell injury, and the third thing which will happen is irreversible cell injury, that is cell death itself, right? So these are the stages of progressive impairment of cell's normal function and structure. Yes, these are happening progressively, right? Let me start chapter 1, adaptations. Can you define adaptation for me? Can anyone define the definition of adaptation? This is the definition of adaptation. I have converted into points for the sake of understanding. Okay, let me understand you all the points one by one. Right. So what are adaptations? The first thing, they are reversible. Of course, once you remove the stress, again it will be under homeostasis. The cell will be homeostasis. So they are reversible. All 5 types of adaptations are reversible. Actually, what is happening during adaptation? Some structural changes taking place inside the cell in response to the stress. The stress can be physiological, like pregnancy, menstruation. It can be pathological, like some disease. So these are actually the structural changes in response to stress. Why they are happening? In order to overcome the stress and in order to allow the cell to survive and continue to function. Just before the exam, if you don't study for 12 hours, you will fail. You don't want to fail, right? You want to pass your exams. That's why you are studying more, right? So you want to overcome the stress, you want to survive over the stress, you want to continue to function, and you want to achieve a new steady state, a new altered steady state, right? Which is temporary. So this is the definition of adaptation. Now you just combine the complete definition. That is the definition given of adaptation everywhere. So the same thing, I have converted the definition in a flow chart, right? So can you see a cell? The cell is under stress, which may be physiological, which may be pathological. Now, in order to survive and continue to function, the cell will adjust some structural changes, some functional changes inside that. And that structural and functional changes are known as cellular adaptation, which are reversible. Once you withdraw the stress, it will be reversible. So this is the definition. So write the definition. After definition, coming on the types. There are 5 types of adaptations. Let's have a look on this diagram, the beautiful diagram showing the 5 types of adaptation. Can you see in the center a cell is shown? This is a normal cell. Can you see? This is a normal cell. Now when the cell is undergoing stress, right? The first thing it can happen, it can increase in size. See this cell, compare the 2 cells. This cell is increased in size as compared to normal cell. Increase in size is known as trophy. The meaning of trophy is size. You know, hyper means more. So more size. The second thing which can happen, size is not increased, but cell is increased in number. Can you see? 1, 2, 3. So from 1 cell, they become 3 in number, right? So they are increasing in number. So increase in number can happen, not size, but the size is same. So it is known as plasia. The word plasia means number. Hyperplasia. So hypertrophy means increase in size, but not number. And hyperplasia means increase in number, but not size, right? So that is the 2 things. Number 3rd, the cell can decrease in size. Decrease in size to adapt. The decrease in size is known as atrophy. Atrophy. You got my point? So A means decrease and trophy means size, as I have told you, right? The 4th thing can happen. You can see here what is happening. Just suppose this cell is squamous, it got converted to columnar, or vice versa. This cell is columnar, it got converted to squamous. So transformation of one type of mature cell from one type to another type. That transformation is known as metaplasia. You got my point? And the last one is the dysplasia. You got my point? Dysplasia. What is dysplasia? It is altered development inside the cell. It is a pre-malignant condition. So there are 2 trophies and 3 plasia. Can you enumerate the 5 type of adaptations? What are the 2 types of trophies and 3 type of plasia? The first is hypertrophy. The second is atrophy. Hypertrophy and atrophy. And 3 dysplasias are there. First is hyperplasia, second is metaplasia, and the third is dysplasia. You got my point? So you will understand it better if you split the term. The term trophy means size. Hyper means more. So here the size of the cell is increased. A means less. So here the size of the cell is decreased. That is hypertrophy and atrophy. Plasia means number. Right, number. So hyper means more. So the cell will increase in number, not the size. Right. Here metaplasia means transformation. The word meta means transformation. Transformation of one type of cell from one type to another. Like from squamous to columnar or from columnar to squamous. Like that. And dysplasia, the word dys is altered. It is altered development. Some developmental abnormalities will happen inside the cell, so it will become pre-malignant. So that is the 5 type of adaptation. You can see the 5 diagrams. You can split the term. You can write the definition. Can you write the definition? Yes. So what are the 5 type of adaptation? Can you tell me the definition? Hypertrophy, increase in size. Hyperplasia, increase in number. Atrophy, decrease in size. Metaplasia, transformation of one type of cell to another. And dysplasia, disordered development. So dys means disordered, meta means transformation, right? I guess everyone got the meaning of the 5 type of adaptations. Now I request all my students to make this comparative table with me. You have seen the questions. To differentiate between any of them, you can get a question. So you should be able to write the differences between all 5. Now write in terms of definition. You already know the definition of all 5. Yes, draw the diagram. I will show you the diagram of all 5 one by one. We have already seen the diagram. Right, I will tell you the mechanism of all 5, how they are happening, and the types along with the examples. The most important, the type with the examples. You got my point? So definition, diagram, mechanism and types with example. We have to cover in these headings. Make this comparative table. So at the end, what is happening now? You will be having this table in your hand and you have to just revise this table before going to your exam. You don't have to revise the entire chapter. Just revise this table. That is more than sufficient. So start with first hyperplasia. Start filling this table. Start with hyperplasia. What is the definition? The definition: hyperplasia. Plasia means number and hyper means more. So it is increase in number of the cell but not in size. Please mention not in size also in the definition. So increase in number but not in size. That is the definition, right? That is the definition. So write the definition. It is increase in number of the cell but not size of the cell, right? And hypertrophy is reverse. It is increase in size of the cell but not the number of the cell, right? So you have to write like this, right? So write the negative finding also. Draw the diagram. This is the diagram of hyperplasia. You can see this is a cell. The cell is under homeostasis. But whenever stress is acting on the cell, the physiological or pathological stress, so cell is doing the adaptation by increasing in number. Here I can see one cell, here I can see multiple cells, but the size is same. You can see the size of this cell is same as that of all these cells. So size is not changing, but the number is increased. So that is hyperplasia. It is clearly visible in the diagram. So write the definition, draw the diagram, come on the mechanism. How the cell increased in number? How the cell is increased in number? You know how cell division takes place? So when this cell want to get divide, you know, on the surface of the cell there are receptors which are known as growth receptors. These are known as growth receptors. So whenever growth factor come and bind with this growth receptor, then only this cell will get the stimulus and it will divide into 2 cells, and from one cell the 2 cells are formed. This is how cell division or mitosis takes place. So for mitosis to occur, 2 things are required. Number 1, growth receptor. Number 2, growth factor. Without which mitosis cannot take place. When growth factor will come, it will bind with growth receptor, then only cell will divide. So during when the cell is normal, this is happening. But when the same cell is under stress, So cell want to divide more. Cell want to divide more and do hyperplasia. So what will happen on the surface of the cell? More growth receptor will come and more growth factor will also come. More growth receptor and more growth factor will come. All the growth factor will bind with the growth receptor and cell will divide continuously and multiple cells are formed. You got my point? So the mechanism is increase in growth receptor and growth factor. In one word, don't draw this diagram. This diagram is for sake of your understanding. So what is the mechanism? You tell me the mechanism. It is increased production of growth factor and growth receptor. So that is the mechanism. In one word, in one line, you have to write the mechanism. Increase in growth receptor and increase in growth factor. This is the mechanism how the cell is doing hyperplasia. So that is the mechanism. I hope you got it. The last thing, come on the types along with examples. Hyperplasia is of two types, physiological and pathological. So what do you mean by physiological? It is not a disease. Something in the body which is not disease but altered. Like pregnancy, menstruation, that is physiological. And pathological is some disease. Tell me 3 examples of physiological hyperplasia and 3 or 4 examples of physiological and 2 examples of pathological. Can you tell me? The examples are more important. So physiological hyperplasia, the 3 examples are in front of you, right? So the first example is the female breast. The size of the female breast increased during puberty, pregnancy and lactation. Have you ever thought why? So this is a female breast. Let me draw a female breast. So this is a female breast. Inside the female breast, let me draw the cells. These are the breast cells, right? These are the breast cells. So consider it a rough diagram just for the sake of understanding, right? So this is a female breast. Now, during 3 situations, what are the 3 situations? During puberty, during pregnancy and during lactation. What happens? You tell me what happens. The size of the female breast increases. Why? Why the size is increased? The size is increased because of increase in number of the cell, not size of the cell. See, here I am drawing all the cells with the same size as the previous one. But if you count the total number, I am not drawing it completely. If you count the total number here, it will be more, of course, from this number. So increase in number of the cell. That's why the complete breast size is increased, right? So what is the stress here? The stress here is the hormone. During puberty, pregnancy and lactation, the hormones are coming in the blood of the female, that is estrogen and progesterone, and that hormones are acting as a stress. Under the influence of that hormones, the hyperplasia is taking place. So it is under the influence of hormones. You got my point? So you can learn with this diagram. So female breast during puberty, pregnancy and lactation under the hormonal stress, it is increased in size and doing hyperplasia. The second is uterus of the female during pregnancy. Uterus of the female during pregnancy. So let me draw a uterus for you and let me show you this is a normal uterus. The size of the normal uterus, and this is the myometrium. You know, uterus have 3 layers, endometrium, myometrium and serosa. So I have drawn the myometrium and these are the myometrial cells. These are the cells of the myometrium. Let me draw few smooth muscle cells for the sake of understanding, right? These are the few cells. This is the size of a normal uterus. Now, this lady got pregnant. If she got pregnant, the size of the uterus increases abruptly, right? To accommodate the fetus inside it. Have you ever thought the size of the uterus, why it is increasing abruptly? Now here the cells in the myometrium, they will increase in number as well as size. So I am saying that pregnant uterus is an example of hypertrophy as well as hyperplasia. If you can see, if you count the number of the cells here from here, so number is also increased, and if you see the size is also increased. So the diagram is just for the sake of understanding. You got my point? So the pregnant uterus is an example of hypertrophy as well as hyperplasia. Currently I am teaching you hyperplasia, so it is coming in this example, that is pregnant uterus, the myometrium of the pregnant uterus, right? And the third thing is the endometrium during a menstrual cycle. As I have told you, in the uterus there are 3 layers. You got my point? In the uterus there are 3 layers: endometrium, myometrium, perimetrium. So let me draw the endometrium now, not the myometrium. In pregnancy I have drawn the myometrium, and now I am drawing the endometrium. This is the endometrium of a normal uterus, endometrial lining. You know, in normal females, every 28 days menstruation takes place. So during menstruation, all the endometrial lining is sloughed off. all the endometrial lining is sloughed off in the bleeding, in the menstruation every 28 days. So the remaining one or two cells are, few cells are left, few endometrial, that will do the hyperplasia and regain the lining again every month. So that is regain of the endometrial lining after menstruation. After menstruation, regain of the lining takes place by hyperplasia, increase in number, and again after 28 days it will be shed, again it will be regained, like that. You got my point? So it is proliferation of the endometrium after menstruation. In all these three, the stress is the hormones, that is estrogen and progesterone in the blood of the female, in all three. So what three examples I told you? See here, the first example is the female breast. Can you see the breast? Female breast, normal breast, and breast under puberty, pregnancy or lactation. See the change, number one. Number two, uterus. See normal uterus size. Can you see here? Normal uterus, and can you see a pregnant uterus? See the change. See the size is increased, right? And if you see the microscopy of both of them, you can see this is the diagram of a non-pregnant uterus. This is the diagram of a pregnant uterus. This is non-pregnant and this one is pregnant. Now see the cells here. Let me draw the cells for you to explain you. See the size of the cells here and see the size of the cells here. And if you see the size as well as number, so from non-pregnant to pregnant, the size is also increased and the number is also increased. So it is an example of hypertrophy as well as hyperplasia. The third example I told you is the endometrium of the female during menstruation. So you can see the phases of the menstrual cycle. You may be knowing that. So first the endometrial lining is thinned out and then again it is proliferated and regain the same during the cycle. So these are the three examples. Don't draw the diagram, just learn the examples. Diagrams are for sake of understanding, right? Number two, these are the three examples of physiological hyperplasia. Now I'm coming on pathological hyperplasia, the three examples again here also. You know, there is a disease known as endometrial hyperplasia, in which the endometrial lining of the female endometrium increased too much under the stress of the estrogen axis. So imagine she is a normal female and that is the endometrium. Can you see the endometrium here of a normal female uterus? If this female is taking axis of estrogen, axis of external estrogen to treat some disease, the estrogen is acting as a stress, and because of under the influence of estrogen, the endometrial lining will become thickened because of hyperplasia. Because of hyperplasia, it is thickened. You know what will be the complaint? The disease is known as endometrial hyperplasia and she will be having heavy bleeding during the menstruation. So she will be complaining, this female will be complaining of having heavy bleeding during every menstrual cycle because of endometrial hyperplasia, which is a disease. It is not a normal thing, it is a disease. So the first example is endometrial hyperplasia. Learn the stress. The stress is external axis estrogen, the stress under which this is taking place. The second example is the skin warts. You know, in the skin we have the cells which are known as keratocytes. You know, these are the skin cells. Now here there is a virus. The name of the virus is human papillomavirus. If HPV virus enters inside the skin cells, it is acting as a stress. The skin cell will do the adaptation. They will divide and small lesions are formed. Can you see these small lesions are known as warts? These are known as warts. It is a disease. So the skin warts, the stress here is HPV virus. Under the influence of HPV virus, it is taking place. And the third thing is the compensatory hyperplasia. The third thing, you know, if someone is donating a portion of liver to some other recipient, you know, in transplant we take a portion of the liver from the donor and get it implanted in the recipient. So in the donor, the liver again it will increase in size after partial hepatectomy, regeneration of the liver. So this portion you are cutting, and after cutting the remaining portion of the liver, again it will increase in size by doing hyperplasia. So here what is the stress? The partial hepatectomy is acting as a stress. So you may be knowing, you should know the stress for each of them. So I have completed the first portion, that is hyperplasia. Tell me the definition. Increase in number but not size. You know how to draw the diagram. You know the mechanism. It is increase in growth factors and increase in growth receptors, right? The types, there are two types, physiological and pathological. 3 examples of physiological and 3 examples of pathological, along with their stress. It should be at the tip of your tongue. This is how you have to write it, either for a short note or a long note. Coming on the second, that is hypertrophy. Hypertrophy. Shall I start the hypertrophy? So hypertrophy is increase in size but not the number. We know that increase in size, not the number. See the diagram. This is a cell under homeostasis. Whenever the stress is acting on the cell is doing the adaptation by increasing in size. Here also we have one cell, here also we have one cell. There is no increase in number but increase in size, that is known as hypertrophy. The word trophy means size. Mechanism. What is the mechanism? Now as I have told you, the cell is increasing in size. This is a cell. On stress, the cell is increasing in size. It is not the swelling. Some students think that it is due to the cell swelling. The cell swells up. No, no, no. It is not the swelling. It is not the swelling. Actually, it is increase in the structural component of the cell. So here the cell is having one nucleus. Nucleus is of course one here also. But here just suppose the cell is having few mitochondria, endoplasmic reticulum, ribosomes, some structural components. All the structural components will increase. So here just suppose there are 10 mitochondria. Instead of 10 there will be 1000. There will be 1000. So mitochondria will increase, endoplasmic reticulum will increase, ribosomes will increase, all the structural components will increase. So basically the mechanism is increased in structural components, all the structural components. So it is increase in structural components and more proteins. By structural components I mean mitochondria, endoplasmic reticulum, ribosomes, all the, but it is not the swelling. Please mind it, it is not swelling. So that is the mechanism. Coming on the types, it is of two types. So hypertrophy is also of two types, physiological and pathological, the two types. So tell me the few examples here. Physiological, you already know one example, pregnant uterus. So pregnant uterus is an example of both. As I have told you, it is an example of both. It is the example of hypertrophy also, hyperplasia also. The second physiological example is the skeletal muscles, the one who is doing the gymming. This example is same. This is the pregnant uterus. You already know, I have explained you, right? Now see the second example. Someone is doing more and more gymming, more and more manual work. See the biceps, triceps, they increase in size. Have you ever thought, do you do gymming? If you do the gymming, the biceps and triceps, they will increase in size. Yes. So why the biceps and triceps increase in size? It is due to increase in size of individual cell, not the number. The number is same, but the size of individual cell inside it, you know, inside it the cells are there, the skeletal muscle, the size of individual cell will increase. That is, the stress here is the manual labor. That is more and more work you are giving. So that is the hypertrophy of the skeletal muscles in athletes, in gymming, in manual laborers. So that can be the, so these are the two examples of physiological hypertrophy. Coming on pathological hypertrophy, here also we have two examples. The first is the heart muscles, that is cardiac muscles. You know, here you can see, can you see the heart, the four chambers of the heart, the two auricles, the two ventricles, right and left side. You know it completely. Now imagine a situation, the person is having aortic wall disease, aortic stenosis. You know, so blood cannot go here completely during the systole. So when the left ventricle is contracting during the systole, the blood cannot go here into the aorta. Because of aortic stenosis, the wall is defective. So there is more blood remaining here in the left ventricle. So what will happen? That is acting as a stress. That is acting as a stress. So the wall of the left ventricle, that will get thickened. The wall of the left ventricle, it will increase in size. The cells inside that, they all will increase in size. That is known as left ventricular hypertrophy. It is a disease. It is a disease. So left ventricular hypertrophy is a disease which is seen in aortic wall diseases, right? Aortic insufficiency. You can say aortic stenosis, right? The second example is the smooth muscles. In the smooth muscles, so you can see here, let me finish the cardiac muscle. If I cut the heart from here and look from above, you can see the two cavities. This is right ventricular cavity. This is left ventricular cavity. Concentrate on the thickness of the ventricular wall. See the thickness of the right ventricular wall and see the thickness of the left ventricular wall. So left ventricular wall is more thickened and the disease is LVH, left ventricular hypertrophy. So same diagram is depicted like this. You got my point? So coming on the second example, the smooth muscles. You know, this is esophagus. See, this is esophagus and this is stomach. This is stomach. At the junction of the esophagus and stomach, there is a sphincter which is known as lower esophagus sphincter, LES. Lower esophagus sphincter. Normally when we eat something, when we swallow something, the food is going here in the esophagus from the mouth. So this sphincter will open and allow the passage of the food from the esophagus to the stomach. This happens normally. But sometimes what happened in a disease, this sphincter, the cells of the sphincter get thickened. they get increased in size and the sphincter will get thickened. So sphincter is closed, permanently closed. It is not opening even on swallowing of the food. So once the person is eating the food, it is not opening. So food is not going into the stomach and it is accumulating in the esophagus only. This disease is known as achalasia. This disease is known as achalasia. So achalasia can be the example. Here the achalasia is due to thickening of the sphincter. You know, the sphincter got thickened. And why the sphincter got thickened? Because the cells inside the sphincter, they increased in size. They increased in size, they are doing hypertrophy. So that can be the reason. The first example. The second example, here the disease is achalasia. The second example, like between esophagus and stomach, we have a sphincter. In the same way, between the stomach and duodenum, there is another sphincter. Between the stomach and the duodenum, the sphincter is known as pylorus sphincter. And sometimes it will get thickened and it is not opening. So the food is not passing from the stomach to the duodenum. It is known as pylorus stenosis. So the two sphincter thickening, the first sphincter in the esophagus and the stomach, the disease is known as achalasia, and the second sphincter between the stomach and the duodenum, the disease is known as pylorus stenosis. You got my point? The two diseases. Let me draw the two diseases together. So here there is a sphincter. You can see this is esophagus, this is stomach, this is duodenum. So here we have a sphincter and here also we have a sphincter. If this sphincter got thickened, food cannot pass from the esophagus to stomach. The disease is known as achalasia, right? And here the sphincter got thickened. The food cannot pass from the stomach to the duodenum. The disease is known as pyloric stenosis. The reason for both of them, here the sphincter is present. The cells of the sphincter get enlarged in size. They got hypertrophy. So the sphincter got thickened. That's why not opening. So this can be the reason. You got my point? So we are done with this also. So can you compare the two? We are done till now with hyperplasia and hypertrophy. Both are done. So definition, both of them you obviously know. It is increased in number, not size. It is increased in size, not number. Diagram definitely you can draw for both of them, right? For the diagram. Mechanism, here the mechanism is increase in growth receptor and growth factor. Here the mechanism is increased in structural components of the cell, but not the cell swelling. Here the types, you know the two types, physiological, pathological, you know the examples. Here also two types, physiological, pathological, you know the examples. The examples of them are important. The types are same, physiological, pathological, physiological, pathological. You got my point? Coming on the third one is the atrophy. Atrophy is decrease in size as well as number. To that point, the cell is still viable. इतना छोटा नहीं हो जाएगा कि cell will die. The cell will decrease in size, but up to a point, the cell is still viable. Can you see this is a cell? When stress is acting on the cell shrink, decrease in size. That is known as atrophy. Definition, you know, diagram you can draw. Here also one cell, here also one cell. It is decreased in size as a part of adaptation. But what is the mechanism? The mechanism is not shrinkage. It is the reduction in structural component. You got my point? So here there is a cell, it decreased in size. So here there is nucleus, right? Now here whatever structural components, the mitochondria, endoplasmic reticulum, ribosomes are present, they all will decrease. The structural component will decrease. So just suppose there are 10 mitochondria, instead of 10 there is 1 mitochondria only. There is few mitochondria, few ribosomes, few endoplasmic reticulum, few structural proteins will be there. So cell decrease in size. So what is the mechanism? The mechanism is reduction in the cell organelles. Basically mitochondria, myofilaments and endoplasmic reticulum. That is the reduction. So that is the mechanism. Coming on the types. As usual there is physiological, as usual there is pathological. The two types of the atrophy is physiological and pathological. These are the 6 examples of the physiological atrophy, right? You know, in childhood, lymphoid organs are more. But as the person grows, the lymphoid organ decrease. That is physiological atrophy. You know, the lymph nodes in children, they are very prominent. But as the children grows in age, the lymph nodes, the lymphoid organs, they decrease in size. Same happens with thymus. In children, in fetus, the thymus is present. But as the age grows, the thymus disappears, right? So the second example can be the thymus. The third can be the ovary after menopause. In a female, after menopause, the size of the ovary shrinks. You know that? The reason is atrophy. Right. Now, the fourth example is the brain. You know, with aging, the brain decrease. Can you see the two brains here? Can you see the two brains? Of course. Can you identify this is a brain of a young person, a 25-year-old young person. And this is the brain of the same person when grown old. old person 80-year-old, the same brain. Can you compare? Can you compare? You know the gyri and the sulci. The gyri, the elevation is the gyri and the depression is the sulci. You may be knowing that, right? Now, if the brain got atrophied, the gyri will become more prominent and the sulci will become more deep. The gyri become more prominent and the sulci become more deep. So I can see the deeper sulci and prominent gyri. Why? Because the brain decreases. The main parenchyma, uska content is less. This is known as brain atrophy, which is a normal thing. Which is a normal thing with age. It is physiological. No one can stop it. It is physiological, right? And the bones also, with age, the bones also, they decreased in size. They become thinned out. And the disease is known as osteoporosis. It is also occurring with aging. It is not a disease. It is physiological. Now, the next example is the uterus. So let me draw 3 uterus in front of you. This is a normal uterus. This is a pregnant uterus. And after pregnancy, this is the parturition. Parturition. You got my point? This is a normal uterus, non-pregnant. This become pregnant. And here after pregnancy, it is parturition. Parturition. Can you see the change? Can you appreciate the change? The female got pregnant, uterus increase in size. And after delivery of the baby, again it decreases in size. Can you tell me the reason why it increases in size? During pregnancy, the 2 reasons. It is due to hypertrophy as well as hyperplasia, I have told you. But why it decreases in size after delivery, after parturition? Again it become normal size. Why? The reason is atrophy. The reason is atrophy. You got my point now? So the uterus is coming under 3 adaptations. What are the examples? So it is coming under the example of hypertrophy as well as hyperplasia as well as atrophy. So during pregnancy, hypertrophy and hyperplasia causes increase in size, and after delivery, during parturition, atrophy causes again normal size. So I guess now it's completely clear, right? So one of the example is uterus here, but after parturition. So it decreases in size. You got my point? So learn the example of physiological atrophy. And now I am coming on pathological atrophy. In the pathological atrophy, again there are 6 types. The first one is the starvation atrophy. Starvation atrophy. Imagine a person is not eating anything. There is a person due to the severe illness, cancer, and stage diseases, the person is not eating. So all the organs in the body, they will shrink in size. All organs are in the body, the complete body shrink in size. All the cells are shrinking in size. And this is known as starvation atrophy. It is due to not eating anything. It is known as cachexia. It is known as starvation atrophy or cachexia, right? Number 1. Number 2 is ischemic atrophy. Here in the diagram, you can see 2 kidneys. Can you see the 2 kidneys? This one and this one. This kidney, the blood supply, this is aorta. This one is aorta. Can you see here the renal artery is normal, supplying normal blood to this kidney. So this kidney is normal in size. This one is normal in size. But see this side renal artery. It is atherosclerotic. So this kidney is receiving less blood. So it decreases in size. It is undergoing atrophy. So such atrophy which occurs due to decrease in blood supply, it is known as ischemic atrophy. This atrophy is known as the name indicates, ischemic atrophy, right? So this is an example of ischemic atrophy, right? Starvation atrophy is due to lack of food. Ischemic atrophy is due to lack of blood. So atrophy of one of the kidney due to atherosclerosis in one of the renal artery. It can occur in brain also, any organ also, right? The third example is neuropathic atrophy. See, this is a patient of polio. These are the patients of the polio. In the polio, see the legs. See the legs and the hands. They are very thinned out. Why? In polio, what is happening? There is a virus, the polio virus. It causes damage to the nerves supplying to these muscles. The muscles are normal, but the nerves supplying to these muscles, they are damaged by the virus. So the organ get thinned out. The nerve supplying to that organ will get thinned out. This is known as neuropathic atrophy. You got my point? So it is due to lack of the nerve. Here the nerves are damaged. So lack of food, starvation atrophy, cachexia. Lack of blood, ischemic atrophy. Lack of nerves, neuropathic atrophy, example polio. The fourth example is the disuse atrophy. Disuse. Imagine if someone is having a fracture. If someone is having a fracture of one of the, you can say tibia. Just suppose tibia ka fracture hai. So the person, what will happen? The person will have a cast here. The person will have a cast for 1 month, 2 months, 3 months. Once the cast is removed, you can see this leg is thinned as compared to the other leg, because this leg was not used for the last 2-3 months. So because of lack of use, it got thinned out. This is known as disuse atrophy. Disuse atrophy. You got my point? So disuse atrophy is due to decreased use of that organ. So it can be due to decrease of food, decrease of blood supply, decrease of nerves, decrease of use. So these are the 4 types of atrophy. You can see the diagram: starvation atrophy, ischemic atrophy, neuropathic atrophy, and disuse atrophy. You can write the examples, right, looking at the diagrams. The next is the endocrine atrophy. Endocrine. You know, we have an axis in our body. What is the axis? The axis is known as hypothalamus, pituitary, and peripheral organ axis, right? From the hypothalamus, the hormones are coming and acting on the pituitary. This is pituitary, right? From the hypothalamus, they are coming to the pituitary, and from pituitary, 4 hormones come. ACTH acts on the adrenal, right? TSH acts on the thyroid, right? And FSH and LH acts on the ovaries and testes on the male and female, right? So these are the peripheral organs. So hypothalamus, pituitary, peripheral organs. This axis runs. We know that. Yes, imagine a person in which the pituitary is damaged. The complete pituitary is damaged. So these hormones are not coming. So neither ACTH nor TSH nor LH or FSH is present. So all the peripheral organs, these 4 organs will reduce in size. So in that person in which the pituitary is damaged, it is having some cancer, it is having some trauma, tumor, it is damaged or it is absent. So the adrenal are decreased in size, the thyroid decreased in size, and the gonads will decrease in size. Now this reduction in size is due to lack of hormones. Because the hormones are absent, it is known as endocrine atrophy. So it is hypopituitarism. If the pituitary is less, it is absent, it may lead to atrophy of 3 organs: thyroid, adrenal, and gonads. That is the example of endocrine atrophy. You got my point? The next example is the pressure atrophy, the last one. You know, if someone is putting a pressure on that other organ, the other organ will get reduction in size. Just for example, in the brain we have meninges, right? In the meninges there is a meningioma. Can you see? There is a meningioma which is arising in the meninges of the brain, that is causing compression of the skull bone. There is a skull bone. It is causing compression. It is putting a pressure. It is putting pressure on the skull bone, causing compression. So skull bone in this area, can you see the skull bone in this area? It is getting reduced. It is getting reduced. It is getting atrophied. So that is the pressure atrophy, erosion of the skull bone due to meningioma. Other examples can also be there, and if no reason is found, it is known as idiopathic atrophy. So what are the types of atrophy? The starvation atrophy, cachexia, ischemic atrophy, neuropathic atrophy, disuse atrophy, you have seen the diagrams, endocrine atrophy, pressure atrophy, and idiopathic. So these are the examples of pathological atrophy. You got my point? So till now we have completed the 3. You know the definition of all 3. You know the diagrams of all 3. You know the mechanisms. You want to revise the mechanisms? So here mechanism: increase in growth factor and increase in growth receptor. Here increase in structural components. Here decrease in structural components, right? You know physiological, pathological, physiological, pathological, physiological. But the more important is the examples of each of them. You should be knowing many examples of each of them, right? Now coming on the next one, that is metaplasia. The 4th one is the metaplasia. Shall I start metaplasia? Yes. Metaplasia is replacement of one type of mature cell by another type of mature cell. That is known as metaplasia. Imagine this one is a squamous cell, it got converted to columnar, or vice versa. It is a columnar, it got converted to squamous. So in under stress, it got converted. So that is the definition, that is the diagram. Definition is done, diagram is done. I guess coming on the mechanism, how actually it is happening. Now it is a misunderstanding. It is not actually the same cell got converted. No, it is not the same cell which was squamous got converted to columnar. No, it doesn't happen. So what is happening? In all organs we have some stem cells. I would like to draw the diagram. Just suppose this is an organ and these are the stem cells. You know stem cells. What are stem cells? They will give rise to the lining of that particular organ. Normally this organ has squamous lining. So stem cells were giving rise to squamous. So these all are squamous. These all are squamous cells. Can you see the red one? These are squamous cells. Now the organ is under the stress. It is under the stress. The stress can be anything, physiological, pathological stress. Under the stress, actually the stem cells will undergo transformation. It is the transformation of the stem cell. Now, what is the transformation? Till now the stem cells were forming squamous cells, but now stem cells will start forming columnar cells instead of squamous. So now gradually the squamous will be replaced by columnar. You got my point? It is not the same cell. जो एक बार स्क्वामस बन गया वो कॉलमनार में कन्वर्ट नहीं होगा, लेकिन जो नया बनेगा आपके कॉलमनार बनेगा वो स्क्वामस नहीं बनेगा. You got my point, I guess. So that is the transformation. Yes. So it is the reprogramming of the stem cells. The stem cells got reprogrammed, right? And now they will form the new cells, right? So here you can see initially they were forming the squamous, but now they are forming the columnar. So this is how you can say, right? It is of two types. What are the two types of metaplasia? What are the two types of metaplasia? The two types of the metaplasia is squamous metaplasia and columnar metaplasia. In squamous metaplasia, initially the organ is having columnar lining and now it got converted to squamous due to stress. And in columnar, initially the organ is having squamous. Not due to stress, it got converted to columnar. So you can learn like, don't get confused. You can learn like whatever final is formed. Finally here squamous is formed, it is squamous metaplasia. And finally here columnar is formed, so it is columnar metaplasia. You got my point? So if squamous got converted to columnar, here columnar got converted to squamous. So this one, the first one, it is known as columnar metaplasia because finally columnar is formed. And here it is known as squamous metaplasia because finally squamous lining is formed. So you have to tell me the examples of the both. So you got my point. What is squamous metaplasia? Initially columnar is there, but due to stress it got converted to squamous. See, initially columnar is there and due to stress it got converted to squamous. So that is squamous metaplasia. So there are four examples. There are four examples. I will draw all four examples for you. I will draw all four examples for you. So let me draw the lungs for you. This is bronchus, trachea and the lungs. Right. Let me draw the prostate for you. You know, in males there is a gland known as prostate gland. This is a prostate gland around the urethra. That is prostate for you. And let me draw the gallbladder for you. You know, gallbladder. We have a gallbladder in which bile is stored. So what's the lining of all these three organs? I will show you the fourth also. First understand. What's the lining? So here the lining is columnar. Pseudostratified ciliated columnar epithelia in the respiratory tract, in the lungs. Right. Here the lining in the prostate also there is columnar lining. Right. In the gallbladder also there is columnar lining. So this is all columnar lining. Columnar lining. Listen. Now I will tell you three stress. God has given the lungs for respiration, but some people smoke. Smoke. So smoke is going. Someone is smoking the bidi, cigarette, you know. So the smoke is going inside. It is acting as a stress. It is acting as a stress. So here smoke is the stress. Right. In prostate some infection took place. So here infection of the prostate. Right, inflammation of the prostate, infection and inflammation is acting as a stress. And in gallbladder sometimes stones happens, stones, right? The stones is acting as a stress. Here the stones or calculi, it is known as calculi is acting as a stress. Under these stress, you got my point, under this stress, the columnar got converted to squamous. You know, columnar here also it will get converted to squamous, here also it will get converted to squamous, and here also it will get converted to squamous. So all these three examples of squamous metaplasia, ultimately squamous is formed. Here the stress is smoke, here the stress is inflammation of the prostate, prostatitis, and here the inflammation is cholelithiasis. You know, lithiasis, the word lithiasis means stone. So that is the three examples. Now you will never forget because you have seen the diagram. You got my point? So see the three examples. In the lung, the stress is the smoke. In the gallbladder, the stress is the stone. Lithiasis का मतलब होता है stone. And in the prostate, the stress is the inflammation, infection and inflammation. So in all the three organs, the columnar get converted to squamous. Right. The fourth example is the cervix of the female. Cervix. So let me draw the cervix of the female. Do you know the diagram of a cervix? What is the lining of the cervix? This is the uterus, this is the cervix, and this is the vagina. Do you know what is the lining of the cervix in a female? I'm asking you. Do you know? Okay. Let me tell you the lining of the uterus. The lining of the uterus is columnar. This is columnar. And you know the lining of the vagina? The lining of the vagina is squamous. The lining of the vagina is squamous. So the cervix is the organ between uterus and vagina. Now what is the lining of the cervix I am asking? So cervix is having a double lining. The portion of the cervix which is in continuation with the uterus, it is columnar only. Because it is in continuation with the uterus, you know. So that's why it is columnar. And this portion is known as endocervix. It is inside, endocervix, right? And the portion of the cervix which is in continuation with the vagina, it is squamous. It is squamous because it is continuation of the vagina, it is squamous. And this portion is known as actocervix. You got my point? Now, please understand in the cervix we have both type of metaplasia. Here normally it is columnar, now in endocervix. Here columnar will get converted to squamous. It can happen. So it is an example of squamous metaplasia. And here normally it is squamous, actocervix. Squamous will get converted to columnar. So it is an example of columnar metaplasia. So we can say endocervix is an example of squamous metaplasia. and actocervix is an example of columnar metaplasia. Can I say? Yes. Tell me the stress in both of them. That's it. So here in endocervix, sometimes the uterus is held with the help of ligaments here. If the ligaments got teared, the uterus will prolapse. The uterus will prolapse. After prolapsing, it is वो टक्कर कर रहा है एंडोसर्विक्स से आके, it is causing hindrance. It is producing stress here for the endocervix, the prolapse. So here prolapse of the uterus is acting as a stress. So because of the prolapse, the columnar get converted to squamous for endocervix, right? And for actocervix, the hormones during reproductive age, the estrogen, progesterone, more hormones. The hormones is acting as a stress, and because of the hormones, this squamous can get converted to columnar. So that is the stress. You got my point. Now in cervix, many MCQs also come and students get confused. Not never confused in cervix. Endocervix is an example of squamous metaplasia. The stress here is the prolapse of the uterus, and actocervix is an example of columnar metaplasia. The stress here is the hormones during reproductive age. So I guess it's clear. Currently I am teaching you the examples of squamous metaplasia. So here you can see endocervix I have written. The stress here is the prolapse. So can you enumerate the 4 examples of squamous metaplasia? The 4 examples of squamous metaplasia. What are the 4 examples of squamous metaplasia? In which normally there is columnar. Due to stress, it get converted to squamous. Can you tell me 4 organs in which there is columnar epithelia is normal? Can you tell me 4 organs? Yes. The 4 organs are lung, that is trachea and bronchus. It can be endocervix. It can be prostate, and it can be gallbladder. Can you tell me the stress in each of them so that they got converted to squamous metaplasia? From columnar, they got converted to squamous. Can you tell me the name of the stress? In the lung, the stress is smoking. In endocervix, the stress is the prolapse of uterus. In prostate, the stress is the inflammation. And in gallbladder, it is calculi, lithiasis or stone. So I cannot simplify more than this. These are the examples of squamous metaplasia. Let me tell you the examples of columnar metaplasia. In columnar metaplasia, the normal lining is the squamous. The normal lining, the squamous, due to stress, it got converted to columnar. You see, normally it is squamous. Due to stress, it got converted to columnar. So here we are having 2 examples. One you already know, the cervix, actocervix. Due to the hormones, due to the estrogen during reproductive age, the cervix got converted from squamous to columnar. Yes, from squamous to columnar, it got converted. The second example is the Barrett esophagus. Okay, I would like to draw this diagram for you. The Barrett esophagus, just a second. So here I will draw the diagram for you. So let me draw the diagram for an esophagus and the stomach. Can you tell me the lining of the esophagus? Can you tell me the lining? The lining of the stomach is columnar. This is columnar. Stomach is always columnar. This is columnar. The lining of the esophagus is always squamous. This is squamous. This is normal. In all normal healthy individual, this is the case. So this is squamous and this one is columnar. The stomach is columnar. Why God has given 2 different lining in 2 organs which are continuous? Where is the acid? The acid is of course present in the stomach. In the stomach we have HCl. We have acid. Yes. Now the columnar lining given by the God in the stomach can bear the stress of the acid. Can bear, right? And we don't have acid in the esophagus normally. But sometimes there is a disease known as GERD. Reflux. GERD का मतलब होता है reflux. The reflux of the acid is taking place in the lower esophagus. So the lower portion of the esophagus is exposed to the acid again and again due to the reflux. So it is acting as a stress. The squamous epithelia cannot bear acid. So it will get converted to columnar. So in the lower esophagus, the squamous get converted to columnar. Not in complete esophagus, mind my words. It is only in lower esophagus. The squamous get converted to columnar, and this portion of the esophagus is known as Barrett esophagus. This portion of the esophagus is known as Barrett esophagus. It is a disease. You got my point? So can I say Barrett esophagus is one of the example in which the stimulus, the stress is the GERD. Always write the stress. Always write the stress. So I am done with the metaplasia also, right? So you already know the definition of the metaplasia. It is replacement of one type of cell to another type of cell. You know the diagram, squamous to columnar, columnar to squamous. Mechanism is reprogramming of stem cells. Write one word, reprogramming of stem cells. And the types, it is not physiological, pathological, write the remaining. The remaining three were physiological and pathological. The hyperplasia, hypertrophy, atrophy, both were physiological and pathological, the two types. Here we don't have physiological and pathological. Here we have squamous and columnar. You may be knowing the examples of the squamous metaplasia and the examples of columnar metaplasia I have discussed. Right? You know the examples. Now coming on the last one is dysplasia. The last one is the dysplasia. So dysplasia, dys means disordered cellular development. Here some cellular changes. The 7 changes will take place which will lead to pre-malignancy. You know, so the definition is disordered cellular development. It is a pre-malignant condition, right? So there are 7 changes which may be taking place in this diagram. I will show you all the 7 changes here so you can understand what is dysplasia. Number 1, increase in number of layers. Can you count the number of layer here? Can you count the number of layer? Only one layer we are having, only one layer. The complete layer you can see, one layer. Can you count the number of layers here? There are multiple layers, multiple. So the first thing, I will enumerate 7 things. The first is increased in number of layers. Number 1, right? So that is the definition of dysplasia. Number 1. Number 2, disordered arrangement. Can you see all the cells here? They are orderly arranged normally. They are orderly, 1, 2, 3, 4. They are one behind the other. Can you see the cells here? They are very haphazard. They are very haphazard. So it is the arrangement which become disordered. So the second is the disordered arrangement of the cell. The second thing, right? The third thing, what is happening? The third thing is loss of basal polarity. What do you mean by basal polarity? See the nucleus here. All the nucleus is towards the base. This is a cell, this is a nucleus. See the cell, the nucleus is not in the center. The nucleus is towards the base, But here nucleus is haphazard. It is present anywhere. So here basal polarity is present. It is known as basal polarity. Basal polarity is present normally. Present means the nucleus is towards the base. But here basal polarity is lost. Basal polarity is lost, like the nucleus is present haphazardly anywhere. That is the third thing. Fourth is pleomorphism. Here the size and shape of all the cells is same normally. But here different cells are different. Some is small, some is medium, some is large. So here size of all the cells is different. It is known as pleomorphism. Pleomorphism means the size and shape of all the cells is different. The fourth thing is pleomorphism. The fifth is the NC ratio. See, the nucleus is small here and cytoplasm is more. So NC, nucleus and cytoplasm ratio, here nucleus is small, cytoplasm is more. So NC ratio is less. But here the nucleus is enlarged and cytoplasm is not in that proportion enlarged. So here NC ratio increased, right? That is the fifth thing. The sixth is hyperchromatism. The chroma, hyper means more, chroma means color. The color of the nucleus here is light and the color of the nucleus here is dark. So that is known as hyperchromatism. And last is the mitosis. Here there is no mitosis inside the nucleus, but here somewhere you can see the spindle formation and mitosis is taking place. So last thing is mitosis. Can you enumerate the 7 things which differentiate normal between dysplasia? Can you enumerate? So you will be able to draw also. So normally one layer is present, but here increased in layer. The layers are increased. Normally the arrangement is ordered. It is orderly arrangement. Here the arrangement become disordered. Here the arrangement become disordered. I have shown you in the diagram. The third thing, what the third thing after that? Here basal polarity is present. Normally the nucleus is towards the base. Polarity means north pole, south pole, pole. So nucleus is towards one of the pole. But here nucleus is haphazard anywhere. So you can say the basal polarity is lost. Right? Normally all the shape and size are same. So pleomorphism is not present. Pleomorphism is absent. But here different cells have different shape and different size. So here pleomorphism is present. Now 3 things about the nucleus. NC ratio, compare both side. Mitosis, both side you have to compare mitosis. And you have to compare the third thing about the nucleus is the color of the nucleus. NC ratio, color. Color of the nucleus is known as chroma. The chroma of the nucleus, right? Hyperchromatism. So you tell me NC ratio, here it is less, here it is more, because the size of the nucleus is more. Here hyperchromatism is not a feature, but here hyperchromatism, the nucleus become dark color. And here mitosis are absent, here mitosis are present. So in short, you can say, ma'am, these are the 7 features which define dysplasia. If you want to say any cell is dysplastic, that cell may have these 7 features. Number 1, increase in layer. Number 2, disordered arrangement. Number 3, loss of basal polarity. Number 4, pleomorphism present. Number 5, NC ratio is high because size of the nucleus is more. Number 4, color of nucleus is also more. Size of nucleus is more, उसका size भी ज़्यादा है, color भी ज़्यादा है. So size ज़्यादा हम measure करेंगे NC ratio से, and color ज़्यादा है, it is hyperchromatism और mitosis भी present है. So these 3 things about the nucleus. So total 7 things are there. You got my point? Total 7 things. This is dysplasia. This is dysplasia. So, and it is a pre-malignant condition. You got my point? So I am done with the 5 type of adaptation. I guess everyone knows the definition of all 5. Yes, 1, 2, 3, 4, 5. You know the diagrams to draw between them. You know the mechanism of all of them, and types. We have types here, here, here. That is physiological, pathological, physiological, pathological, physiological, pathological. Here we have types as squamous and columnar. Here we don't have any types. Right? So this is how you have to write the differences if it is asked in any of them. In your exam, if differences coming in any of them, between hypertrophy, hyperplasia, metaplasia, any of them, you can write the differences. If it is a long question, you can enumerate all of them, and if it is coming a short note on any one of them, you can write that also. Right? So we are done with the 5 type of the adaptations. I guess everyone is confident now in that. Right? So now let's have a look again on the university exam questions from this topic. Can you write all 5 cellular adaptation? Can you write types of them? Can you write mechanism of all 5? Yes. And can you write the examples? Yes. Can you define hypertrophy, atrophy, metaplasia, dysplasia, hyperplasia, the all 5 of them? So can you define them? Can you write their types? Can you write their mechanism? Can you write their example? You know everything about each of them. Can you differentiate any 2 of them? If I ask you the difference between hypertrophy, hyperplasia, yes, you can write. Can you write the difference between atrophy, hypertrophy, hyperplasia? Can you write the differences between metaplasia and dysplasia? Yes. You will be able to write the differences between any of them. Right? Now these are the university exam questions from this topic. I guess you are perfect in this topic. So thank you.